So this is a challenge because we built extra time specifically into this session so that we could have a group dialogue and hear the ideas of the group. And it looks as if people are using the time to have dialogue. So that's attention. Good morning, everybody. My name is David Meyers, and I'm the Chief Medical Officer at the Agency for Healthcare Research and Quality. And I'd like to thank the NAM and the other sponsors of this meeting for inviting me to participate today and as a member of the Planning Committee. On the Planning Committee, my role, I discovered, was to always ask why, and are we sure, and can we make this more complex? I was the one that wanted more and more, and so what I think Peter did is he said, okay, let's do a session where instead of narrowing our focus, instead of having a goal of arriving at group clarity, the goal for this session is to muddy the waters, to stir things up, to get all of us to think about the things that we don't usually think before. So my challenge to all of us today is, as we listen to these four presenters who were chosen because of the perspectives they could bring to us, don't think about how their ideas align with the ideas that each of you brought to the meeting today. But look for the places where they challenge you, where they don't align with what you've thought of, where it doesn't resonate, where there's a clash of ideas, or perhaps the areas that you just haven't thought about before that help you expand what you've already been thinking about, the potential solutions to the problems we're working on together, that say, wait, we need more. So our goal in this part before lunch is to push our thinking as far as we can. In doing that, the Planning Committee thought about, well, we could look at different populations of people with great need from the healthcare system. Or we could look at different models of how systems do this. Or we could approach this from how we look at data to understand and to segment the population. We couldn't agree, so we chose one of each, or a couple of each. So these folks, there is no common theme here. Again, we are trying to create dissonance. So I'm very excited to introduce to you Bruce Chernoff, who's the President and Chief Executive Officer of the SCAN Foundation. The SCAN Foundation's mission is to advance a coordinated and easily navigated system of high-quality services for older adults that preserves dignity and dependence. Our second speaker is Frank DeGree, who is the Woodward Chisholm Professor and Chair of the Department of Family Medicine at the University of Colorado. He'll be followed by Lisa Iazzoni, a Professor of Medicine at Harvard Medical School and Director of the Mongan Institute of Health Policy at the Mass General Hospital in Boston. And finally, David Meltzer, the Chief of the Section of Hospital Medicine, Director of the Center for Health and Social Sciences at the University of Chicago's Urban Health Lab and the Chair of the Committee of Clinical and Transitional Science at the University of Chicago. And if all goes well, we'll have plenty of time for questions among the panel and then as a larger group. So with that, Bruce.